Good morning, everyone. Welcome to the breakout sessions for the 2022 Nebraska Conference on Health Equity. My name is Erica Akers. I am a Public Health Equity Fellow within the Office of Health Disparities and Health Equity at DHHS. And I'm pleased to introduce our session speaker, Aurora GrantWingate. She is a member of and partner of the Engagement Association, Associate for the National Association of Community Health Workers. Aurora will be presenting Building the National Association for Community Health Workers, Authentic Collaboration, Equitable Transformation, and Sustainability. After her presentation, we will end with a Q&A. So during the presentation and after, please feel free to use the chat box to input any questions or comments you will have, and we'll address them toward the end. Over to you, Aurora.
Thank you so much. And first, I want to thank everyone who planned this conference to invite us here today. We really appreciate the opportunity to come and speak to you, and I'm really looking forward to, at our Q&A, getting to meet you guys and hopefully answer some of your questions. So again, my name is Aurora GrantWingate, and I work for the National Association of Community Health Workers, or NECHE, as our member and partner engagement associate. I've been working for the association since October 2020. I am here today filling in for our executive director, Denise Smith, who was unexpectedly put on leave this week, but she is the one who expertly created this PowerPoint and many of the talking points. So let's get started. This presentation will articulate the role of NECHE in unifying the CHW profession, amplifying CHW roles, leadership, and capacity during the pandemic, and in developing data and policy tools for state and federal advocacy to build capacity and infrastructure for CHW sustainability. Founded in April 2019, after years of planning and organizing by CHWs and allies, NECHE launched as a 501c3 nonprofit membership-driven organization with a mission to unify community health workers across geography, ethnicity, sector, and experience to support communities in achieving health equity and social justice. Our values, self-determination and self-empowerment of our workforce, integrity of character, dignity and respect for every human being, social justice and equity to ensure fair treatment, access, opportunity, and outcomes for all individuals and community. These guide our work. They are our North Stars we will use to support our members, foster partnerships, advocate nationally, develop strategic objectives, and assess our impact. And as you can see, just this April, NECHE turns 3 years old. So we're having a bit of a celebration all year long as we continue to grow and build our organization. NECHE builds individual and organization leadership capacity of our members to advance strategies, policies, and programs that center community voice, advance CHW professional values and roles, and drive health systems, innovation, and sustainable change. NECHE provides technical assistance and collaborative opportunities among states and regional CHW networks and associations, state health departments, offices of minority health and national health disparity and equity partners. NECHE is also a national clearinghouse for CHW policy, conducts and disseminating workforce assessments and research, and represents the workforce and policy development and advocacy, as well as convening conferences, providing training, and more. And once again, we are really working together to see a common vision, to see community health workers united nationally to support communities in achieving health equity and social justice. We use the term community health worker as an umbrella term that includes community health representatives who may work on tribal nations, promotores de salud, peers, and other workforce members who are frontline public health professionals that share life experience, trust, compassion, cultural values with the communities they serve. And here you can see a variety of different pictures of community health workers across the country and throughout the nation, working with community members to deliver services, take blood pressure, do outreach and education before and during the pandemic. Before we get into the heart of the presentation, I want to share a little bit more about NECHE as an organization. Once again, we are a national membership organization. Just this fall, we actually got members in all 50 states and a few of the US territories. The states you see here in green are the states where we have the highest concentration of members, and it tends to be where there's the highest concentration of community health workers in the US, in places like Texas, California, Illinois, and up in the Northeast. Here you can learn a little bit about our members and where CHWs are employed. The majority of CHWs work in community-based organizations, with smaller amounts working in hospitals and health systems, federally qualified health centers, and other places like larger nonprofits, universities, and so on and so forth. And you can see that our ally members share similar sort of characteristics and are working in similar institutions. Also, our members and CHWs in general have dozens of areas of expertise, such as maternal and child health, educating about HIV and AIDS and STDs, immigrants and refugees, mental health, and so on and so forth. CHWs really cover a large array of areas and have expertise and lived experience in all of these different areas. Once again, we are a membership organization. Our membership starts at $20 for individual CHWs. And throughout our presentation, I'll talk more about different ways that you can get involved, whether you're a member or not, and learn more about the CHW profession and connect to other community health workers across the country. I also really want to highlight our annual Unity Conference. This is by far the biggest event we do each year. This has been going on for longer than NECHE existed as an organization. CHWs have been coming together for about a decade with their peers to learn more about what's happening with the profession. But this summer, we will be having our next virtual conference again this year on August 3rd and 4th. Last year, we had over 800 registrants. We had over 70 speakers, 30 workshops and round tables, and as well as networking opportunities. We are excited to announce this is going to be free for our CHW members, and it's going to be very affordable for those who also don't want to become members. We really encourage those who are interested in the CHW profession or who are CHWs themselves to come and meet your peers across the country and learn what the hot topics are right now in CHW leadership and professional development. So now really what we're going to get into today are first the pillars of the CHW profession. Who are CHW and why do we see them as the future leaders of the public health workforce? After that, I'm going to talk a little bit more about the role of CHWs in COVID-19 and how CHWs really innovated COVID-19 response and built capacity during the pandemic. And lastly, I'm going to talk some about barriers and opportunities for CHWs. What are the barriers and opportunities to advance sustainability of the CHW profession in programs and services? So first, I want to talk about why community health workers. So first, the US really has a shortage of public health workers, and this really increases our weakness in pandemic readiness. Our executive director often talks about how we had a very robust federal response and a state response to COVID-19, but we really didn't have a community level response. And community health workers really fill in those gaps and connect to people at that local level. Later on in the presentation, I'll talk more about COVID-19 and really the lack of trust that community members often feel and how community health workers often help bridge that gap. And community health workers also reduce costs and disease by working upstream and prioritizing the social determinants of health. And increasingly, community health workers are being recognized by their achievements in promoting racial and health equity for marginalized communities. So first, CHWs are really a unique workforce. Already with 2 decades of national workforce policies created by the APHA. CHWs actually have a US Department of Labor workforce classification. Because of a lack of professional identity by both CHW themselves and their employers, can be really underutilized. And it's part of why there can be sort of lacking robust data for the CHW profession. Community health workers are recognized by the ACA as health professionals. And CHWs have unique professional core competencies that have been endorsed by CHWs across the country at the local, state, and national level. CHWs were also recently classified as essential critical infrastructure workers by the US Department of Homeland Security in March 2020 when the pandemic began, and that same output was also put again in August 2021 to recognize again the great work that community health workers were doing during the pandemic. Once again, CHWs are really unique because they're a community-based workforce. They are really grounded and committed to the community level advocacy and building those trusted relationships with community members. And this trust and respect really allows community health workers to go deeper in to the lack of trust community members and especially marginalized communities have with many different government organizations and agencies and often sort of medical institutions. CHWs also have many different state and local level CHW networks, associations, and coalitions who train, mentor, and partner CHWs. And CHWs are really central to all efforts to address clinical and community integration and the social determinants of health. CHWs are really a historic and diverse workforce. Often when people talk about the history of CHWs, they talk a lot about the beginnings of the federally qualified health center movement in the 1960s, which is definitely where a lot of the term and the beginning of sort of researching CHWs came from. But we often recognize as CHW as something that exists in many cultures throughout the world and throughout history. Our executive director often talks about how you can really find community health workers in the history of enslaved Africans in the United States who were helping other enslaved people and community deliver babies, provide health services, and so much more. We also see this represented in community health representatives in tribal nations across the country. And again, CHWs are known by dozens of different work titles, such as promotoras, aunties, peers across the country. CHWs are really diverse in ethnicity, language, and culture. And CHWs often have this really close relationship with their community or culture because they're dealing with those same structural barriers to health or possibly the same chronic diseases. CHWs are also unique because they're a real cross-sector workforce. While many CHWs are working closely with community-based organizations or at community-based organizations, they're often working across different organizations to help connect their communities to the services they need. A CHW working at a community-based organization might be helping their community members navigate different federal or state organizations. They might be helping them navigate clinical and medical services. And those CHWs who might be working for the public health department or working directly in clinics might be doing the same. So CHWs are heavily integrated and helping to connect community members to all these different organizations. And all of this really helps by reducing barriers and building capacity for community members to help achieve better well-being. Again, CHWs are really integral to addressing the social determinants of health. And CHWs are creating these formal and informal networks with other CHWs across these sectors to integrate the needs of individuals and community members. And importantly, CHWs are a proven workforce, often because CHWs is not something that is widely known by the general population. People think that there hasn't been evidence of their effectiveness, when in reality, there's over 60 years of research on CHWs, especially in maternal and child health, chronic disease intervention, immunization, oral health, and so much more. A lot of this has been documented in control trials, reviews, and return on investment studies of CHWs. And really, CHWs are increasingly recognized for their contributions to addressing racial equity in the social determinants of health, and by connecting individuals to their basic needs, and by organizing communities to address inequitable social conditions. And here on the right, you can see one of the papers that we've done with ASTO around CHW effectiveness throughout history. But unfortunately, CHWs tend to be a precarious workforce. It is majority female, and many CHWs carry a marginalized identity. Many are from tribal nations, immigrants or refugees, have been justice involved, people in recovery, and so on and so forth. CHWs tend to be among the lowest paid of public health professionals, even though they are these frontline workers working directly with community, which often can put them in harm's way and vulnerable to secondary trauma, violence, and communicable diseases. CHWs unfortunately have an inconsistent state and national policies, which leads to inconsistent professional identity. Many CHWs might be performing the roles of CHWs, but not necessarily recognize the term. One thing we hear a lot at NECHE through our webinars or our outreach or doing presentations like this is that people with different job titles might be hearing about how we define community health workers and all of a sudden sort of recognize that, oh, they feel like they identify with that term, and they finally find this larger community that can help with their professional identity and capacity building. And unfortunately, CHWs have a lack of sustainability in their roles. And we mean this lack of sustainability in many different arenas, such as training, legislation, professional development, career ladders, and especially financing. CHWs, especially working at community-based organizations, are often funded by short-term grants that might be 6 months to 2 years, which can leave many CHWs to be constantly having to find work or have to find their own grants to sustain their jobs. And CHWs unfortunately have a lack of data infrastructures and national workforce studies to map workforce demographics, capacity needs, and this also leaves us less prepared to mobilize for emergencies at the state, local, or national level. Something like a way to nationally connect with community health workers across the country could really be an asset to something like the COVID-19 pandemic, to be able to push out the latest updates and recommendations directly to community health workers so they can help their community members navigate those new updates. Now I'm going to switch a little bit and talk more directly about COVID-19, CHW's involvement, and the capacity and innovation that CHWs have created for themselves during the pandemic. Right at the beginning of the pandemic, CHWs were immediately on the front lines, helping community members, answering tough questions, in connecting people to essential services. Unfortunately, what we saw at a national level is that many CHWs were let go of their work and were searching for jobs. This often came because many employers, not fully understanding the CHW job, might not know how to transition them from doing sort of at home or street outreach into remote work. Which again left many CHWs without work, but regardless, many CHWs were working directly with community members, and we at the national level were doing advocacy to get CHW hazard pay, PPE, and again do education to stakeholders around the important role that community health workers could have been playing in officially answering community members' questions and doing contact tracing, and so much more. So again, throughout the COVID-19 pandemic, NECHE was very involved in advocating for community health workers. We did this through many webinars, some with the CDC. We actually did one of the first trainings with the CDC for community health workers on COVID-19 in English and Spanish. We helped co-author many different blogs about the importance of community health workers and how people should be hiring them and paying them to work with community members during COVID-19. We also helped co-found an organization called the Vaccine Equity Cooperative with many other national organizations like Health Leads, Partners in Health US, Native Way Federation, and more, to really advocate for a community-based workforce response to the pandemic and help uplift recommendations to make the vaccination efforts at a state, local, and federal level more equitable. And we often saw community health workers and a community-based workforce as a really important part of that effort. We also were helping promote different ways that stakeholders could amplify the work of CHWs, as well as making national recommendations on how the federal and state government could better integrate CHWs. And throughout the pandemic, as most have likely heard, really led to an increase in hate crimes against Asian Americans and Pacific Islanders. We at NECHE have been trying to address this and educate CHWs on how they can be involved to help educate community members around sort of the truth around COVID-19 and to really get involved in preventing racism and social justice. We put out a one-pager, we have promoted videos on our website, and in general have created sort of advocacy around this issue. And again, we have been working since the beginning of the pandemic to talk about systemic racism and vaccine acceptance. Many marginalized communities don't have good trusting relationships with medical institutions or the federal government because of the systemic racism that these communities have experienced. And again, community health workers can really play a vital role in bridging this sort of trust gap that many communities feel. And a lot of this we recommend community health workers do through providing social determinant of health services. Often what we've heard throughout the pandemic is that folks will go out just to do vaccine outreach, and folks will say, well, if the government or if medical institutions don't care about diabetes or obesity or other things that are plaguing our communities, why do they care about COVID-19? But to have community health workers or other members of the community-based workforce come and address the social determinants of health alongside COVID, this can really help increase trust and start rebuilding those relationships with medical institutions and with the federal government for the long haul. And that's really what we see the role of community health workers in long term. And we really feel, again, CHWs are critical to bridging silos, social determinants of health and well-being during the pandemic and beyond. The COVID-19 pandemic highlighted several long-present challenges facing the United States, including public health worker shortages, weakness in pandemic and other emergency readiness, lack of investment, capacity, and equitable partnership with community-based organizations, and racial and health inequity for marginalized communities. And here on the right, you can see a graphic that sort of describes a little bit more what the social determinants of health are, if folks aren't familiar with that. Thinking not just about folks taking their medication or going to the doctor as being what keeps folks well, but really looking at what are their health behaviors, what is their physical environment and are their basic needs being met? Do folks have equitable access to food and water and shelter, which creates healthy environments for them to make those doctor's appointments and choose better, healthier habits. And now I want to talk a little bit more about advancing CHW professional identity, policy leadership, and some about what different organizations are doing to further this. CHWs are equity-driven leaders who want to be delivering culturally appropriate direct services and realize their roles as policy advocates to address their professional identity and impact systems change. They have knowledge and skills to address prevention, the social determinants of health, and racial equity, and to access to care based on a broad set of CHW roles. CHW networks, which are organizations led or co-led by CHWs focused on membership development, training, career pathways, and advocacies, are not seen as having potential to scale CHW recruitment, hiring, training, and leading policy development without authentic partnership, funding, and funding. They lack capacity, data, and tools to engage as authentic partners. Federal agencies and national actors and payers lack policy and strategies to broadly describe CHW sustainability and directly partner and contract with CHW networks that include CHW networks integration into pandemic response. And here you can see some of the blogs that we have written, as well as other partners of ours that sort of describe this issue of funding CBOs and CHW organizations equitably, especially during the COVID-19 pandemic. And here are some of our recommendations to help advance the CHW profession. One of our top ones is to broaden the definition to include financing, scope of work, training, infrastructure, career ladders, professional associations, policy, and evaluation when organizations are looking to contract and work with community health workers. Sometimes people treat community health workers as simply sort of doing an admin or to sort of distribute surveys, but CHWs really do so much more in their roles and can offer so much more in their partnership. We recommend organizations cultivate and amplify CHW professional identity, policy leadership, and CHW network capacity. We want to lift up and center values and approaches that pursue racial equity, social justice, diversity, and inclusion. And we want to promote policies that respect, protect, and authentically partner with CHWs and their networks. And we want to disseminate the best practices from the workforce, and we want to center CHWs in the creation of things like playbooks, tools, and webinars that create these best practices for other organizations. And we really want to create tools and the means to collect data on CHW workforce trends, experiences, skills, and opportunities. And we want to build a national feedback loop to activate members for future pandemic response and resilience. Here I want to talk a little bit about a project that we are doing with Johnson & Johnson. And this is part of their Race to Health Equity. Since the end of 2020, we brought together a dozen leaders across the country who are CHWs and promotoras with many different areas of expertise to come and build a national survey. Throughout this presentation, I've mentioned a couple times that CHWs sort of lack good national data on the workforce, even sort of basic things about, what is the racial and ethnic breakdown of CHWs? What are the job titles they're going by? How much are CHWs getting paid? What do they want out of their career ladders? And that is some of what this survey they created were trying to address. And this was a very long 51 question survey with over 900 responses. The CHWs who took this survey came from all 50 states and something like 800 zip codes. They spoke over 27 languages and had a range of different experiences as well as areas of expertise. We are working right now to analyze this data and to bring up some of the workforce trends to better advocate for CHWs and let stakeholders, organizations, and other CHWs know what CHWs want out of their career and what do they think could help them better serve their communities. So the survey is a big part of this project, as well as just lifting up the voices of these national leaders. A big part of this project has been allowing these national leaders to create national webinars to build CHW capacity. Through the last sort of year and a half, we've had probably half a dozen different webinars given by these CHWs on a range of topics, such as how to sort of found and build a CHW organization, how to use your lived experience, and how to sort of tell stories with it. We recently had a leader give a presentation on domestic violence and how CHWs can be an advocate and help folks in those situations, as well as policy and in other areas. In the next coming months, we have some webinars coming up around a CHW toolkit. What do CHWs need to sort of do their jobs and build capacity, as well as a webinar on CHWs working with justice-involved individuals or folks who are re-entering society after being incarcerated, and the role CHWs can play, and also the barriers that can often be found in CHWs trying to seek work with those individuals. We have also been doing more around national partnership around racial equity. Recently, we did a joint webinar with the APHA CHW section around new legislation they are doing to advance CHW's role in racial equity. And this is a really great opportunity for folks to get involved and learn more about how CHWs can be those essential change makers and be working directly with community members and organizations to lift up racial equity. I also want to mention one of the things that we have been most proud of in our short term as the National Association has been creating our national policy platform. This is something we put out just last winter in January 2021, after we have been hearing so much from our workforce about what they have been experiencing during COVID and looking for information and language on what should employers, legislators know about working with community health workers. And the recommendations that we came up with and heard really fell into 3 different buckets. One around respecting CHWs and making sure CHWs were respected in the workforce, really advocating for permanent funding streams for CHWs and understanding that global history of the workforce, protecting CHWs by recruiting and hiring authentic CHWs, and some just about basic worker safety. CHWs need PPE and access to mental health services. They need to be paid a living wage with benefits like any other job, and to partner with CHWs to integrate, provide direct reimbursement, provide representation and leadership and membership of association and coalitions, and be prioritized and included when folks are trying to make CHW legislation. We are actually currently in the process of enhancing and improving this policy platform. Right now, it is very centered on COVID-19, and we wanted to create a new and improved one that really took into account sort of more long-term issues with the profession. Definitely taking into account everything that has happened and that we've learned during the pandemic, but also looking beyond. As part of my presentation, I'd also love to show you this quick sort of role play that one of our staff members wrote around the policy platform, so folks can better understand what it's really about and what enhancing it means. This is about 10 minutes, and you're going to see some great folks in it, such as our executive director, some of our national leaders, some of our founding board members. So let me see if I can play that. Sorry, folks, give me a minute. I might have to, oops. So sorry about this, folks. I'm just gonna bring it up real quick. The one downside to the Zoom presentation, sometimes those links just don't want to pop up. Okay, here we go, folks.
WCHW viewers, I'm Bernadine Mavungu. Breaking news regarding an important national organizational policy development for community health workers in the United States. WCHW news correspondent Michaela Trujillo has more on the story. Michaela?
Thank you, Bernadine. This is Michaela Trujillo, reporting to you live from outside the NECHE headquarters here in Boston, Massachusetts, where Executive Director Denise Smith has just announced plans that the organization will release a new and improved national policy platform as early as August of this year. I'm here now with Denise and two representatives of the NECHE team, CHW leader Lucia and founding board member Lisa Renee. Good evening, Denise, Lucia, and Lisa. Can you tell our viewers what exactly is this national policy platform?
Thank you, Michaela. I'd be happy to. The NACHW National Policy Platform is the result of a collective effort to summarize CHW identified solutions to some of the most pressing issues facing the US CHW workforce today. The recommendations within the National Policy Platform align with the strengths of our workforce. They highlight the value of CHW leadership and capacity of our workforce, as well as our state and regional CHW networks, associations, coalitions, and alliances. The policy platform centers many of the policies and best practices that are already endorsed within our field and contain recommendations that apply to COVID-19 response, as well as long-term CHW policy development. The document is available on our website for anyone to reference as an educational tool for policymaking or advocacy and to preserve and promote the CHW professional identity nationally.
I like to think of this document as the CHW workforce holding up a megaphone and saying, hey, to anyone listening, this is who CHWs are. We are diverse, we are self-determined, and we are united. This is how you can respect, protect, and partner with us.
Wow, this is great. Thank you, Lisa, Renee, and Denise. For our viewers who may not be familiar with it, would one of you be willing to give us some specifics? What exactly does the National Policy Platform address? Lucia?
Absolutely, Michaela. There are three major policy recommendations within this document, and Lisa Renee just mentioned them. The first one is respect, the second one, protect, and the third one, partner with CHWs. It covers a lot of ground. If you read through the document, you'll see that pages 3 and 4 speak to a wide range of issues. Everything from, for example, hazard paid and compensation to training and funding, policy making, and contracting with community-based organizations and CHW networks, and much more.
Wow, this is such a holistic approach, and no surprise there. Something we often hear from the CHW community is the phrase, nothing about us without us. Could one of you briefly explain what that means and how it applies to this national CHW policy platform, Lucia?
Thank you for asking, Michaela. Nothing about us without us refers to the idea that CHWs are the experts of our own profession, and the CHW's workforce is the rightful decision maker when it comes to policies and rules about our profession. This is what self-determination means to me, and it's a core CHW value.
Thank you. Denise?
Lucia was a major contributor to the current policy platform, and I want to thank you, Lucia, for your authentic collaboration. I see it as my responsibility as a CHW, as a member of the workforce, and having the great honor of being the executive director for NECHE, to ensure that we're an organization that can walk that walk of nothing about us without us. So even though many NECHE staff, board members, and partners are longtime CHWs ourselves, we didn't want to write a policy platform behind closed doors. Instead, we wanted to bring NECHE out and to tap into and uplift the power of CHWs and what we have in our diversity across this great nation. We've seen firsthand how the power is really strengthened when we work together on a project, as meaningful as these national policy recommendations. And I know we can always improve the way we go about developing organizational policy like this now and for the future.
Wow, this is really beautiful. Thank you, Lucia and Denise. That's a really important context for our viewers to hear, and incredibly important work. Lucia, if you wouldn't mind, walk us through the process of what did creating the national policy platform entail?
Well, Michaela, to be honest, writing the first national policy platform was no easy task, and it's not perfect, but we really did it with intention and from a place of CHW values, corazón, and in the spirit of solidarity, or in other words, unity. To make a long story short, this document that was co-created and updated over the past 2 years of town halls, calls with over 30 CHW networks, associations, 3 national CHW pools, numerous partner meetings, member input of the Biden administration's national plan to build back better, and in consultation with CHW leaders and allies all over the United States.
Impressive. That sounds like a very comprehensive approach to amplifying the voices of CHWs. Lisa Renee, maybe you could tell us what prompted this decision announced today to enhance the national policy platform.
Absolutely. So one reason we're updating the policy platform is that the current one really focuses an awful lot on COVID-19, which, as you know, is an ever-changing situation, and now, unfortunately, part of the fabric of our lives. I have no doubt in my mind that we will address COVID-19 in the 2022 National Policy Platform, but we're also thinking outside and beyond the pandemic. Another reason is that over the past 2 years, our membership has grown hugely. And now there are so many more CHW networks and associations across the country that we really want to make sure that everybody has a hand in what our policy platform looks like. Recognition of the CHW workforce is very robust right now. So it's critical that we keep this important document up to date, continuously check it, and to the best of our abilities, look for consensus as we move forward to continue to build unity.
Wonderful. And tell us, how will you engage CHWs as co-creators of the National CHW Policy Platform this year? Who will be involved?
Sure. Well, Michaela, this time around, we're approaching this as a process that does need to be developed, and we can do that as we improve it. But we also built space in the process this time to collect feedback from participants about the process itself, which will give NECHE's board and staff some of the information we really need to make necessary changes as we continue to implement this process ongoing.
How exciting. When does this all start, Lisa Renee? Oh, I'm sorry, Denise, that question is for you, ma'am.
Yeah, I want to answer. Let me. I am so glad that you asked because, bam, we are kicking this journey off right now. Yes, I know you have never heard me do this on a webinar. We are kicking this off right now at this very moment with this community of people. And I'm so grateful that each and every one of you joined. I want to thank you again for your deep partnership, for your commitment to community, for your compassion to health equity and social justice, and for your willingness to devote time and energy to this process with us today. I want to thank Angie Kuzma for a bombastic script and for creating this. I cannot wait to see what becomes of this process. What I have said to her privately and publicly is we never discount small beginnings. It's when we come together authentically in 2s and 3s, in 5s, in 10s, that we become many. Many of our organizations began this way, and many of our advocacy and our movements, the National Association began with committed board members like Lisa Renee Holderby-Fox, the OG of OGs. Okay, let's just celebrate who we have in the room. and understand that we are doing great things. So I want to thank you all in advance. That's right. That's right. Absolutely. Thank you, Sarah. Coming from a PhD, I would expect nothing less, Sarah. Okay. You had to hit us with the science. I get it. I get it. All right. With that, you guys know I love a mic, but I'm going to turn the mic back over. I want to thank my staff, who is just incredible. We're growing. I think you all see it. Bernadine and Michaela. I want to thank Angie. I want to thank Josie. I want to thank Aurora, our board members, our allies and friends, and every CHW. You're amazing and continue your great work. And with that, I'll let you go. Oh, and Peter, he's always off camera, so I want to thank Peter as well. Okay, thanks a lot, everybody.
What a story. So from all of us here at WCHW News, have a good night.
Thank you, folks, for
WCHW.
Indulging me in watching that video. I always think it's so nice to allow folks to see our other team members and what they're doing. And I think it just does a wonderful job of really explaining what NECHE is about, the unification and the policy, and hearing from CHWs themselves and what they want. This pretty much wraps up my presentation, but I want to remind folks ways they can get involved with us. We have a free newsletter you can sign up for on our website at nechwa.org. We welcome membership, which gets you access to a couple of our internal meetings with our board members, such as our policy committee calls, as well as our learning collaboratives. We hope to see many of you at our annual virtual Unity conference this summer, August 3rd and 4th. If you sign up for our newsletter, you'll get all of those updates, as well as we do probably 3 or 4 webinars a month on different topics related to the CHW profession. I want to once again thank everyone for inviting NECHE to be a part of this conference.